Good afternoon. Thank you for having me in today. I appreciate the opportunity to speak with you about your communications project. I'd like to kick off our discussion today with a quote from your Deputy Director, Stephen Mayberg. That's what we're really here to talk about today, is to set a foundation and a new direction for communicating and collaborating within Department of Mental Health and all of the hospitals throughout the state. I truly believe that by implementing a Cisco Unified Communications Architecture, that it will provide you the tools and capabilities to improve communication and collaboration that should have a direct impact on care for the individuals here at your hospitals, and also reduce the costs associated with communicating. I'd like to break our conversation up today into three distinct areas. I'd like to review the current system issues. Then I'd like to talk about the benefits of a standardized enterprise architecture throughout all the hospitals. Then I want to discuss impact of care and some of the tools and capabilities that you'll have at your disposal when implementing an enterprise architecture for communicating and collaborating. How does that sound? Great, let's get started. We know that with the current system today at Napa State Hospital, and we'll focus on Napa for this discussion, as they will become potentially the pilot site for this enterprise voice architecture. We know that we've dealt with multiple failures at the hospital. A lot of the failures we're dealing with are physical limitations of the current copper infrastructure and also the age of it. These failures have caused significant outages, and these outages have led to loss of communication, loss of collaboration capabilities, which has caused great concern for the individuals at Napa and DMH-wide, because without communication capabilities, healthcare staff, individuals and patients do not have the ability to communicate, call, respond if there is an emergency. Now we've taken a look at the physical attributes of the current system. And keep in mind, we need to add 250 phone lines to provide communication capabilities to the additional staff here at Department of Mental Health. Looking at the physical infrastructure, there is significant issues that have Napa, looking at different options. Now with the current infrastructure, the conduits lined with lead, therefore leading to hazmat issues if we were to dig up that conduit. We've looked at adding additional copper lines into the conduit. The conduit is full, we cannot do that. The options that Napa has to look at are two. One is building out that parallel copper infrastructure on campus. That includes trenching to every facility on campus, which is over 150 buildings. Doing that in parallel with the current copper system, because we cannot sustain the outages to rip and replace the copper. Now this leads to significant cost, millions and millions of dollars, multiple years to implement, and also very high safety risk, because there will be mass construction on campus, and safety risk not only to your staff but to the individuals. Napa has explored another option, and that's what we're really here to talk about today, and that is looking at an enterprise approach to communicating and utilizing current implemented infrastructure, the fiber optic network, to support those communication needs. let's take a look at enterprise architecture and what are some of the requirements NAPA has, DMH has statewide, that this enterprise architecture can meet. Aaron Jones, the ISO, has provided us with a list of security requirements that is driven by HIPAA and FIPS and the SAM security requirements for the state. And based on those security requirements, we developed a solution to meet all of those security requirements. We also looked at how we can utilize, again, the current infrastructure to support communication capabilities. Now, by implementing an enterprise architecture statewide, we utilize current fiber optic infrastructure on the campus. When we connect all the hospitals and traverse communication capabilities over IP, that allows us to eliminate such things as long distance cost, which are significant here. We ran a quick study and looked at the costs associated with NAPA for long distance. And just looking at NAPA, talking with the hospital. $12,000 a month associated with cost between NAPA and DMH. Those costs can be eliminated as we connect these facilities up across IP and implement an enterprise communications architecture. We eliminate other things such as fax services. I realized working with the receivership that because the institutions, and in this case the hospitals at mental health, are paper-based at this time, that sometimes an entire medical record of an individual needs to be faxed to a location so that individual can be provided care. There are significant costs associated with doing that. We can eliminate those costs by implementing an enterprise architecture based on Cisco Unified Communications. Another area of concern for NAPA specifically, and I know for some of the other hospitals as I've spoken with them, is the fact that there is no redundancy with the current phone system. That if the one location info into the facility is taken out, they no longer have the ability to communicate with anybody, out internal or external, which causes, again, major safety and security risk. We have the ability to implement redundancy not only as the central call processing, but redundancy at each site. Therefore, if a location would lose connectivity, in this case to the wide area network, they still have the ability to communicate internally on the campus, thus providing them a level of safety and security. Now, one of the other things that we've talked a lot about with the current IT staff, and one of the main initiatives for the CIO is to consolidate, centralize IT resources. So what we're looking at is a solution that helps support that initiative. So when we implement a centralized call processing solution, we will enact a different support model that meets the initiative of the department when it comes to a centralized support model. And I did want to take a minute to discuss some of the additional tools and capabilities that an enterprise collaboration communication system from Cisco provides. Now, I've looked and done some research on mental health and seen that, like the health side on the correctional institutions, there's a lot of vacancies for healthcare professionals. One of the things that you now have the ability to do is to expand the reach of your specialist to all the hospitals. Because you are based on a standard enterprise architecture communication system, you have more tools such as voice communications, obviously, video communications, and the ability to share data. This allows